Here are some notes on frontotemporal dementia. The pathogenesis of this unfortunate condition is a mutation in TDP43. There are also tau protein inclusions like PIC bodies. The signs and symptoms are early onset, usually starting around 50s to 60 years old. The initial behavior or personality changes are most prominent, and you need 3 of the following 6 to be diagnosed with frontotemporal dementia: disinhibition, apathy, loss of empathy, compulsions or rituals, hyperorality, and executive dysfunction. A smaller percentage, around 20%, have motor neuron disease, like what you might see in ALS. Upper motor neurons might be affected, where you'll have hyperreflexia. Lower motor neurons can also be affected, where you'll have fasciculations. The diagnosis is primarily clinical. You can also do neuroimaging. As you can see back here, you can see frontotemporal changes, whereas the rest of the brain looks a little more normal on these MRI images. You can also rule out other disorders with neuroimaging, and you can look for that frontal, anterior, temporal lobe atrophy, as I mentioned. The treatment and management is kind of dual. The non-pharmacologic side involves behavioral modification, and the pharmacologic side involves SSRIs and atypical antipsychotics.